You, Dr. Goldstein. Sergey, thank you.
Hi everyone, so my name is Dr. Goldstein and I'm a practicing orthopedic surgeon. I'm a guy with an electric saw and a drill, and I put all the shiny metal stuff, nails and screws inside people. So I'm also a member of Refuah Israel, which is a community of hundreds of physicians which advocate against politicization in the medical field and against political strikes under the leadership of the Israel Medical Association. And it was not long time ago when we established the collaboration with Israel Asmaït, Israel Independent Israel, with Yonatan Segev. And to tell the truth, I am not a man of vision, but I am a man of action. And Yonatan was my inspiration. He impressed me with his energy and commitment and deep knowledge of the issue. And you made me to allocate lots of hours to go through complicated legal documents of international health regulations and pandemic amendment and all the appendices and all the additional files, and just to study the issue, and eventually it's thanks to you that I get here. Woo! And to the parliament as well.
I can say the same on Alfred. I learned to him about the complex, and on Philip and on Reggie. It's my inspiration.
So thank you for that. Today, during the parliamentary hearing, yes, Professor Nadav Davidovich lied to the members of parliament. It's professor's lie. Yes. It was not the first time he's doing it. During the session today, I analyzed one of his articles and contradicted many of his findings in relation to international health regulations. So what he told to the parliamentary committee today is that 98.9% or 99.8% of Israel physicians are in favor of international health regulations. He didn't tell most, he didn't tell all of them, but he stated the exact percentage just to make it pseudo-scientifically valid. Pseudo-scientifically valid. Okay, and unfortunately, most of Israeli physicians are not in favor and are not against. They are just unaware of these regulations. And this really both sad and dangerous, because usually we as practicing physicians, we concentrate upon patient treatment, whether in the community or in the hospital settings, emergency rooms and operation theaters. We just do our job day after day without thinking out of the box, mostly. And this issue of international health regulations and of this attempt of World Health Organization to infringe on our sovereignty is getting mostly unnoticed by the medical community. That's why it's so important to raise the awareness in the general public and also among medical professionals. Because these regulations will have a huge impact on our everyday work during the next pandemic or next global medical emergency. Because according to these regulations, the sovereign states would be, the developed states would be obliged, would be forced to waive at least 20% of their medical resources for the sake of developing countries, preferably in the region. And you all know what are the developing countries in the region, which are mostly the enemy countries. At least 20%, 10% for free, and 10% more with a significant discount. Okay, so this will rob our budget and our medical system of essential resources during the next medical crisis. So it's crucially important for the medical professionals to understand this, how this will impact our professional activity during the next medical emergency. And I had an interview to Radio 102 about a couple of hours ago. It will be transmitted on Wednesday. That medical professionals really should wake up and study the issue and take action and to resist. Because even before we are medical professionals, first of all, we are human beings. And in Passover Haggadah, every year we remind that we were slaves to the Pharaoh in Egypt, and now we are free people. And in order to remain free people and to keep our sovereignty, we need to act. Otherwise, it will be too late.
Wow.